Most people who end up in the emergency room with heart failure say the same thing. They say, "Doctor, it came out of nowhere." But it didn't. It never does. After more than 2 decades working with cardiac patients over the age of 65, I can tell you this with certainty. Heart failure almost never arrives without warning. It sends signals, quiet ones, subtle ones, signs that look like ordinary aging, signs that feel like tiredness, signs that get dismissed, brushed aside, explained away. Until one morning, the lungs are filling with fluid and the ambulance is already in the driveway. And here is what breaks my heart about that. It didn't have to happen that way. I'm Dr. James Harlow, and in this video, I'm going to show you the 7 warning signs that your heart is struggling, long before it fails. But I'm not going to stop there, because knowledge without action is just worry. After each sign, I'm going to give you the specific, natural, research-backed steps that can help slow what is happening, protect the heart muscle you still have, and, in many cases, reverse the early damage before it becomes permanent. These are not miracle cures. I want to be honest with you about that. They are real, accessible strategies grounded in decades of cardiovascular research. Things you can begin today, without a prescription, without a gym membership, without turning your life upside down. Before we go further, drop a comment right now with just your age. Nothing else, just your age. I want to know who is watching because these signs show up differently at 65 than they do at 75 or 85. And if you've noticed that your shoes feel tighter in the evening than they did in the morning, type the word swelling in your comment. That detail matters more than you know. You'll understand exactly why in about 2 minutes. Sign 1. Swollen ankles and feet, and what you can do about it naturally. Let's start here, because this one is the most overlooked, and it may be the most important. You kick off your shoes after dinner, and your ankles look puffy. Your socks leave a deep ring around your lower leg. You press your finger into the top of your foot, and the skin holds the indentation for a second or two before it rises back. You tell yourself it's the heat, or that you were standing too long, or that it's just what happens as you get older. That explanation, that one right there, is what costs people years of their life. Here is what is actually happening. Your heart is a pump. That is its entire job. Move oxygen-rich blood out to the body, pull oxygen-depleted blood back in, over and over every second of every day. When that pump begins to weaken, the return flow is the first thing to suffer. Blood backs up, it stalls, it pools, and because of gravity, it pools in the lowest parts of your body first: your feet, your ankles, your lower legs. In medicine, we call this dependent edema, and in older adults, especially those over 65, it is one of the earliest and most reliable indicators that the right side of the heart is no longer keeping pace. Now here's what makes it so easy to dismiss. It comes and goes. In the morning, after lying flat all night, the fluid redistributes, the swelling fades. You think the problem resolved itself. But by evening, after hours of sitting or standing, the fluid settles back down. The swelling returns. It wasn't gone. It was hiding. I treated a woman named Dorothy, 71 years old, from Georgia. She came in for a routine visit and mentioned, almost as an afterthought, that she'd been buying wider shoes for 6 months. Her old ones felt too tight by afternoon, she had told her previous doctor. He suggested cutting back on sodium. That advice wasn't wrong, but it missed the bigger picture entirely. When I ran an echocardiogram, Dorothy had moderate right-sided heart dysfunction that had been progressing silently for over a year. Her body had been sending the signal every single evening, and it had been quietly dismissed. We caught it. We adjusted her treatment. She is still living independently today, 4 years later. Natural preventive measures for swelling. Now, here is what the research shows you can do naturally to address this early. First, reduce sodium, but do it intelligently. The connection between sodium and fluid retention is real, but the source of sodium matters enormously. Most seniors are not adding salt at the table. They are getting it from processed foods, canned soups, deli meats, packaged bread, and restaurant meals, often without realizing it. Research published in the Journal of the American College of Cardiology found that reducing dietary sodium to under 1,500 milligrams per day measurably reduced fluid accumulation in patients with early cardiac dysfunction. That is roughly half a teaspoon of salt across the entire day. Read labels. Cook at home when possible. Choose low-sodium versions of the products you already use. That single change can reduce ankle swelling within days for some people. Second, elevate your legs for 20 minutes each afternoon. This is not folklore. This is physiology. When you elevate your legs above the level of your heart, gravity works in your favor. It encourages pooled fluid to drain back toward the chest, reducing swelling and lowering the workload on the right side of the heart. 20 minutes in the afternoon, legs propped on pillows or a footrest above heart level can meaningfully reduce the fluid load your heart carries into the evening. Third, gentle walking. Your calf muscles are sometimes called the second heart. When they contract during walking, they squeeze the veins in the legs and push blood upward toward the heart. Even a 10-minute walk twice a day activates that pump mechanism and reduces the stagnation that leads to swelling. Not a fast walk, not a workout, just movement. Steady, gentle, consistent. Fourth, magnesium-rich foods. Several studies have found that adequate magnesium intake supports healthy vascular tone and reduces the tendency for fluid to leak into the tissues. Foods rich in magnesium include spinach, pumpkin seeds, almonds, black beans, and avocado. These are not dramatic interventions, but they are not nothing either. They are daily choices that compound over time. If you're still with me and finding this useful, type the number 1 in the comments right now, because the next sign is one that millions of seniors write off as a sleep problem, when the truth is something far more serious. Sign 2. Waking up at night unable to breathe, and what you can do about it naturally. Picture this. It's 2 in the morning. You wake up suddenly. A feeling that you cannot get enough air. Your chest feels heavy. You sit up fast, instinctively, dangle your legs over the side of the bed, and after a few minutes, it eases. You tell yourself it was a bad dream, or acid reflux, or a bad sleeping position. You go back to sleep. This experience has a specific medical name: paroxysmal nocturnal dyspnea, and in older adults, it is one of the clearest warning signs that the left side of the heart is beginning to fail. Here is the physiology. When you lie down flat, the fluid that spent all day pooling in your legs is suddenly free to redistribute upward. In a healthy heart, that shift is managed effortlessly. But in a heart that is struggling, pressure builds behind the left ventricle. Fluid accumulates in the tiny air sacs of the lungs. And your body wakes you up, because in a very real sense, it is beginning to drown. Slowly, silently, while you sleep. Sitting upright relieves the sensation because gravity pulls that fluid back down. It is not that the problem resolved, it is that your posture temporarily reduced the pressure. The underlying problem is still there. Natural preventive measures for nighttime breathlessness. First, elevate the head of your bed, not just your pillow. there is an important difference. Stacking pillows bends your neck forward and can actually restrict airflow over time. What you want is a gradual incline from your hips upward. Using bed risers or a wedge pillow under the mattress, elevating the head of the bed by 4 to 6 inches reduces the rate at which fluid redistributes to the lungs during sleep. Many of my patients notice a meaningful improvement in nighttime breathing within the first week of making this change alone. Second, reduce fluid intake after 6 p.m. This is not about dehydration. It is about timing. The fluid your body takes in during the evening hours is exactly what redistributes upward when you lie down. Stay well hydrated during the morning and afternoon. Taper fluid intake after dinner. Small sips in the evening rather than large glasses. For many older adults with early cardiac dysfunction, this single adjustment reduces nighttime episodes noticeably. Third, CoQ10, coenzyme Q10. This is one of the most studied natural compounds in cardiac care for older adults. CoQ10 is a substance your heart cells use to produce energy at the cellular level. As we age, natural CoQ10 levels decline significantly, and the heart muscle, which demands more energy than almost any other organ, suffers first. A landmark study published in the Journal of the American College of Cardiology found that daily CoQ10 supplementation in patients with heart failure reduced major cardiac events by nearly half compared to a placebo group. The typical dose studied is 100 to 200 milligrams daily. Always discuss supplementation with your physician before beginning, particularly if you are on blood thinners or cardiac medications. But the evidence behind CoQ10 for heart function is among the strongest we have for any natural compound. Fourth, practice slow, diaphragmatic breathing before bed. This is simple. It costs nothing, and it works. Slow, deep breathing activates the parasympathetic nervous system, your body's rest and recover mode, and reduces the elevated nighttime heart rate that worsens fluid redistribution. Try this before sleep. Breathe in slowly through your nose for 4 counts. Hold gently for 2 counts. Breathe out slowly through your mouth for 6 counts. Repeat for 5 minutes. Research on this technique in cardiac patients shows measurable reductions in nighttime blood pressure and improved sleep quality, 2 factors that directly affect how the heart manages fluid overnight. Sign 3. A cough that never fully goes away, and what you can do about it naturally. This one surprises people. When I tell patients that their persistent cough may be connected to their heart, I usually get the same reaction. A slight tilt of the head, a pause, and then, "But I thought that was just post-nasal drip." Let me explain what is actually happening. When the left side of the heart struggles to pump efficiently, pressure builds in the blood vessels supplying the lungs. As that pressure rises, fluid seeps through the vessel walls into the lung tissue itself. Your lungs respond the only way they know how. They try to clear the irritation. The result is a cough, usually dry, sometimes producing thin, white, or pinkish mucus. Often worse lying down, often worse at night. Persistent, nagging, the kind that never quite resolves no matter how many lozenges you try. In cardiology, we call this cardiac cough, and it is missed constantly. Not because it's rare, but because it sounds exactly like every other cough. I had a patient, Harold, 74, from Tennessee, a retired school teacher. He had been coughing every night for 4 months, 2 rounds of antibiotics, an antihistamine, a referral to an ENT who found nothing remarkable. By the time he reached my office, his left ventricular function had dropped significantly. His body had been telling him every night, in the only language it had. Natural preventive measures for cardiac cough. First, hawthorn berry. This is perhaps the most well-researched herbal compound for early cardiac support. Hawthorn extract has been shown in multiple European clinical trials to improve cardiac output, reduce congestion in the pulmonary vessels, and lower the pressure that causes fluid to leak into lung tissue. It works primarily by dilating blood vessels slightly and reducing the resistance the heart pumps against. Less resistance means less backup pressure. Less backup pressure means less fluid in the lungs. Less fluid in the lungs means less cough. The research is not preliminary. A large German trial called the SPICE study followed over 400 patients with early heart dysfunction and found that hawthorn extract measurably improved cardiac function over a 6-month period. Typical studied doses range from 160 to 900 milligrams of extract daily. Again, discuss with your physician before adding any supplement, especially alongside cardiac medications. Second, address any acid reflux. Here is something counterintuitive. Acid reflux and cardiac cough can coexist, and acid reflux can worsen nighttime breathlessness in someone whose lungs are already under pressure. Elevating the head of the bed, avoiding large meals within 3 hours of sleep, and reducing acidic foods in the evening addresses both conditions simultaneously. Third, steam inhalation. This will not fix cardiac cough, but it reduces the irritation and dryness that makes it worse. A bowl of hot water with 2 drops of eucalyptus oil, towel over your head, breathing slowly for 5 to 10 minutes. Soothes the airway, loosens any mucus that is settled, and reduces the reflexive coughing that disrupts sleep and strains the chest. Small relief, real relief. Fourth, track the pattern. Begin noting when the cough occurs. Is it worse at night? Does it improve when you sit up? Is it dry or producing mucus? That pattern, especially positional worsening, is the clinical signal that separates cardiac cough from respiratory cough. That note, written down and brought to your doctor, could change your diagnosis entirely. Sign 4. Fatigue. That sleep doesn't fix, and what you can do about it naturally. This is the sign most seniors continue to be the fact to the other type of coffee leader. This is the sign most for midger. If you believe cardiac coffin continue to be an excellent and it not be a little bit no one but canically means you. This is the sign most sleep doesn't fix, and what you can do about it naturally. The sign most seniors experience first, and the one most often blamed on age alone. You sleep 8 hours. You wake up tired. A short walk leaves you needing to rest. You used to keep up with your grandchildren. Now an afternoon with them requires a 2-day recovery. And everyone says, that's just what happens. You're not 40 anymore. But here is what I need you to understand. Normal aging does reduce energy gradually. That is real. But there is a measurable difference between the gradual shift in stamina that comes with healthy aging and the deep, persistent exhaustion that comes when your heart is not delivering enough blood to meet your body's demands. When cardiac output drops, your body begins to prioritize ruthlessly. It pulls blood toward vital organs, away from the arms and legs, away from digestion, away from everything considered non-essential. Your muscles don't get what they need. Simple tasks feel impossibly heavy. Your thinking slows. Your motivation disappears. And the detail that separates cardiac fatigue from ordinary tiredness? Rest does not fix it. You sleep, you rest, you take it easy, and you wake up just as depleted. That is the signal. Rest should restore you. When it stops doing that, the problem is not in your schedule. It's in your chest. Natural preventive measures for cardiac fatigue. First, L-carnitine. This is an amino acid compound that plays a critical role in transporting fatty acids into heart muscle cells where they are burned as fuel. Research published in the American Journal of Clinical Nutrition found that older adults with cardiac-related fatigue who supplemented with L-carnitine showed measurable improvements in exercise tolerance, reduced fatigue scores, and better oxygen utilization by the heart muscle. The heart runs on fat as its primary fuel. L-carnitine is the delivery mechanism. When it is depleted, as it commonly is in aging hearts, the fuel supply to the cardiac muscle becomes inefficient. Typical doses studied range from 1,000 to 2,000 milligrams daily. Discuss with your physician, particularly if you have kidney disease. Second, the Mediterranean-style diet. Of all the dietary patterns studied for heart health, none has more consistent, long-term evidence than the Mediterranean approach. Not a strict diet, a pattern. Extra virgin olive oil as your primary fat. Fatty fish, salmon, mackerel, sardines, 2 to 3 times per week. An abundance of vegetables, particularly leafy greens. Legumes, lentils, chickpeas, black beans, several times per week. Walnuts and almonds as daily snacks. Moderate whole grains. Very little processed food. Very little red meat. The Predimed trial, one of the largest nutrition studies ever conducted, found that this dietary pattern reduced major cardiovascular events by approximately 30% compared to a low-fat control diet. That is a medication-level result from food alone. Third, walk after meals. Not a workout, not a mile. A 10-minute walk after eating. Research from the University of Otago found that short post-meal walks were more effective at stabilizing blood sugar and blood pressure than a single longer walk at another time of day. For the aging heart, the period immediately after eating is a time of increased cardiovascular demand. Digestion draws blood to the gut. Blood pressure fluctuates. The heart works harder. A gentle walk spreads that demand out and reduces the peak load on the heart. Fourth, address sleep quality directly. Cardiac fatigue and poor sleep create a vicious cycle. A tired heart contributes to poor sleep. Poor sleep weakens the heart further. Research shows that sleep apnea, extremely common and underdiagnosed in older adults, dramatically worsens cardiac function by repeatedly depriving the heart of oxygen overnight. If you snore, if you wake unrefreshed despite adequate hours, if your partner has noticed you stop breathing during sleep, ask your doctor about a sleep study. Treating sleep apnea alone has been shown to measurably improve cardiac ejection fraction in older adults with early heart dysfunction. Sign 5. Needing to urinate more at night, and what you can do about it naturally. Most older adults consider this normal. To some degree, it is common. But there is a version of frequent nighttime urination that has nothing to do with your bladder and everything to do with your heart. Here is the mechanism. During the day, when you are upright, your struggling heart cannot circulate blood efficiently to the kidneys. Reduced kidney perfusion means reduced urine production. So during waking hours, you may actually urinate less than normal. But at night, when you lie down, the heart's workload is slightly reduced. Circulation to the kidneys improves. The kidneys respond by processing more fluid, and suddenly, at 1 a.m., 3 a.m., 5 a.m., you are up again. 2, 3, 4 times a night. This pattern, reduced daytime urination, frequent nighttime urination, is called nocturia, and in older adults with developing heart failure, it is a consistent and measurable pattern. I once reviewed the case of a 79-year-old man from Ohio referred to me by his primary care physician. He had been to a urologist twice. Prostate was unremarkable. No infection, no structural issue. He was urinating 4 times a night and sleeping in a recliner because lying flat made him feel vaguely uncomfortable. Both of those details, the recliner and the nocturia, were pointing directly at his heart. He had stage 2 heart failure that had been completely missed because his symptoms had been routed to the wrong specialist. Natural preventive measures for nocturia linked to cardiac function. First, taper fluids after 6 p.m., but hydrate aggressively in the morning. The timing of fluid intake matters enormously. Drink the majority of your daily fluid, aim for 6 to 8 glasses, between waking and 4 p.m. This ensures your kidneys process most of that fluid during daylight hours when you are upright, not during the night when you are horizontal. It will not eliminate nighttime urination entirely, but it can reduce it from 4 trips to 1 or 2. Second, dandelion leaf tea. This may surprise you. Dandelion leaf is a natural diuretic, meaning it helps the body eliminate excess fluid. But unlike pharmaceutical diuretics, it replaces the potassium it removes. Most conventional diuretics deplete potassium dangerously in older adults, which can destabilize heart rhythm. Dandelion leaf encourages gentle, steady fluid clearance without that depletion. 1 to 2 cups of dandelion leaf tea in the late morning helps the body clear excess fluid earlier in the day, so less redistribution occurs at night. Research published in the Journal of Alternative and Complementary Medicine confirmed significant increases in urinary output following dandelion leaf extract, with a favorable safety profile in healthy adults. Discuss with your physician if you are on diuretic medications, as combining the two without adjustment can lower blood pressure excessively. Third, compression stockings during the day. This is a simple, inexpensive intervention with strong evidence behind it. Graduated compression stockings, worn from morning until early evening, prevent fluid from pooling in the lower legs throughout the day. Less fluid accumulated in the legs by evening means less fluid available to redistribute to the chest and kidneys at night. One small study from the University of Toronto found that daytime compression stocking use reduced nighttime urination frequency by an average of 1 trip per night in patients with leg edema and cardiac dysfunction. 1 fewer trip per night. That is 1 more hour of uninterrupted sleep, night after night, year after year. That matters. Sign 6. Rapid or irregular heartbeat, and what you can do about it naturally. People describe this sign in a very specific way. They say, "My heart was racing for no reason," or "It felt like it fluttered, just for a second, then it stopped," or "Sometimes it pounds so hard I can feel it in my throat." And then they say the phrase that concerns me most. "But it went away, so I figured it was nothing." Palpitations, the awareness of your own heartbeat, are not always serious. Stress, caffeine, dehydration, all can cause a brief, harmless flutter. But in older adults with developing heart failure, palpitations carry a different weight. As the heart weakens, the chambers can begin to enlarge. Stretched, dilated chambers create irregular electrical pathways. The heart's natural rhythm becomes unstable. What you feel as a flutter, a sudden racing, a skipped beat, or a pounding in your neck may be your heart struggling to maintain its normal electrical sequence under the pressure of reduced pumping function. In some cases, these episodes are the first visible sign of atrial fibrillation, an irregular rhythm that dramatically increases stroke risk in seniors. Pause on that. An irregular heartbeat connected to early heart failure, connected to elevated stroke risk. These are not separate problems. They are often the same problem wearing different faces. Natural preventive measures for irregular heartbeat. First, magnesium glycinate. This is perhaps the single most underappreciated mineral in cardiac electrophysiology. Magnesium is essential for the electrical stability of the heart. It regulates the flow of calcium and potassium in and out of heart muscle cells, the exact mechanism that governs normal heart rhythm. Studies consistently show that older adults, particularly those on diuretics, are deficient in magnesium. And magnesium deficiency is directly linked to increased frequency of atrial fibrillation and ventricular ectopy. A review published in the American Journal of Clinical Nutrition found that magnesium supplementation reduced arrhythmia frequency in patients with cardiac dysfunction. Magnesium glycinate is the best absorbed form for older adults, gentler on the digestive system than magnesium oxide. Typical studied doses range from 200 to 400 milligrams daily. Always check with your physician, particularly if you have kidney disease. Second, omega-3 fatty acids. The anti-arrhythmic effects of omega-3s are among the best documented in cardiovascular medicine. Omega-3 fatty acids, found in fatty fish, flaxseed, and fish oil supplements, stabilize the electrical membranes of heart cells, reducing their tendency toward erratic firing. The GISSI Prevenzione trial, a major Italian cardiovascular study, found that omega-3 supplementation significantly reduced the incidence of sudden cardiac death and arrhythmia-related events in patients with cardiac disease. 2 to 3 servings of fatty fish per week, or a high-quality fish oil supplement of 1,000 to 2,000 milligrams daily, provides meaningful cardiac electrical protection. Third, eliminate stimulants strategically. Caffeine, alcohol, decongestants, certain antihistamines. All of these can trigger palpitations in older adults with cardiac vulnerability. This does not mean eliminating coffee entirely. It means being intelligent about timing and quantity. 1 cup of coffee in the morning, not 3 cups, not after noon. Alcohol, if consumed, in very small amounts and never within 3 hours of sleep. Track your palpitations in a journal. Note what you had to eat or drink in the 2 hours prior. Patterns emerge quickly, and patterns give you control. Fourth, practice heart rate variability breathing. This technique, also called resonance breathing, directly trains the heart's electrical regulation system. Breathe in for 5 seconds, breathe out for 5 seconds. Repeat for 10 minutes daily. Research from the HeartMath Institute and several peer-reviewed cardiology journals shows that regular practice of this technique measurably improves heart rate variability, a key marker of cardiac electrical stability in older adults with early heart dysfunction. 10 minutes a day, no equipment, no cost. Measurable results within 2 to 4 weeks. Sign 7. Sudden weight gain over 2 or 3 days, and what you can do about it naturally. Most people associate sudden weight gain with eating too much, but I want you to think about a different scenario. You step on the scale one morning. You weigh the same as you did last week. 3 days later, you've gained 4 pounds, maybe 5. You haven't changed your diet. You haven't done anything differently. but the scale moved, noticeably, fast. That is not fat. That is fluid. And in older adults, rapid fluid retention over 48 to 72 hours is one of the most urgent warning signs that heart failure is accelerating. Here is what is happening. When the heart's pumping efficiency drops, the kidneys interpret the reduced blood flow as a signal that the body is volume depleted. They respond by retaining sodium. Sodium holds water. Water accumulates in the tissues. The result is visible swelling and a weight increase that happens faster than any normal dietary change could explain. A weight gain of 2 or more pounds in a single day, or 3 or more pounds in 3 days, is a threshold that every senior with cardiac concerns should treat as an urgent signal. Not a "let's see if it goes away" situation. A "call your doctor today" situation. Natural preventive measures for fluid retention and weight monitoring. First, daily morning weigh-ins, non-negotiable. Get on the scale every morning, same time, before eating, after using the bathroom. Write the number down, not in your head, on paper, or in a log on your phone. A 2-pound rise in a single day, or a 3-pound rise over 3 days, is your signal to call your doctor that same day. This single habit, 60 seconds every morning, can prevent emergency hospitalization. That is not an exaggeration. Fluid retention monitoring is a cornerstone of heart failure management programs at every major cardiac center in the country, because it works. Second, potassium-rich foods. Potassium is sodium's natural counterbalance. Adequate potassium intake encourages the kidneys to excrete sodium, and water follows sodium out of the body. Foods highest in potassium include sweet potatoes, white beans, bananas, avocado, spinach, lentils, and low-sodium tomato products. Research published in the American Heart Association journal Hypertension found that increased dietary potassium significantly reduced fluid retention markers in older adults with high sodium sensitivity. This is food working as medicine. Third, reduce processed and restaurant foods aggressively. One restaurant meal can contain 2,000 to 3,000 milligrams of sodium, twice the recommended daily limit for an older adult with cardiac concerns, in a single sitting. That sodium load can trigger measurable fluid retention within 24 to 48 hours. Cooking at home with herbs, lemon, garlic, and spices instead of salt is not a minor lifestyle adjustment. It is a direct intervention in the fluid physiology that drives cardiac weight gain. Fourth, hibiscus tea. This one has genuine clinical evidence behind it. A study published in the Journal of Nutrition found that daily hibiscus tea consumption reduced systolic blood pressure significantly in adults with mild hypertension, comparable in effect to certain first-line medications. Hibiscus works through a mechanism that gently inhibits the same pathway that conventional ACE inhibitor medications target, reducing the kidney's tendency to retain sodium. 1 to 2 cups of hibiscus tea daily, consumed in the morning and early afternoon, provides meaningful, gentle support for fluid balance in the aging cardiovascular system. Tart in taste, deep crimson in color, and quietly powerful for the heart. Bringing it together, the full picture. Let's step back for a moment, because when you look at these 7 signs together, a pattern emerges, and so does an opportunity. Swollen ankles, breathlessness at night, a chronic cough, fatigue that rest cannot fix, nighttime urination, an irregular heartbeat, rapid fluid weight gain. None of these shouts heart failure on its own. Each one can be explained away, and that is exactly the problem. Heart failure is not a single dramatic event. It is a slow erosion, a quiet, gradual loss of function that the body compensates for month after month until it can no longer compensate. By the time most seniors are diagnosed, the heart has already been struggling for a year or more. The body adapted. You slowed your pace. You stopped doing the things that made you breathless. You bought wider shoes. You slept in the recliner. You called it getting older. But here is what I need you to hold on to. The same biology that produces these warning signs also responds to natural intervention. The heart is not a machine that simply breaks down. It is a living organ. It repairs, it adapts, it strengthens when given the right environment, the right nutrients, the right movement, the right sleep, the right reduction in the burdens it carries daily. You are not powerless here. The natural strategies in this video, the sodium reduction, the CoQ10, the magnesium, the omega-3s, the walking, the daily weigh-ins, are not peripheral. They are the foundation. And in early cardiac dysfunction, the foundation is where the outcome is decided. What to do today? Not this week, today. Sit down with a piece of paper. Write down any of these 7 signs that you have noticed in your own body in the past month, the past 3 months, the past year. Even the ones you've already dismissed. Write them down. Take that paper to your doctor. Show them the list. Say, "I've been researching early heart failure, and I want to go through these with you." A good physician will take that seriously, and if you have multiple signs on that list, especially swelling, nighttime breathlessness, and rapid weight gain together, do not wait for a routine appointment. Call today. Begin the natural strategies now, alongside that conversation, not instead of it. Your body has been speaking. It has been patient. It has been repeating itself. The question is whether you are ready to listen and ready to respond. Closing. I want to say something before I go. The goal of this video is not to frighten you. Fear does not save lives. Knowledge does. Every patient story I shared today, Dorothy with her swollen feet, Harold with his cough that no antibiotic could touch, the man in Ohio who slept in his recliner for a year, every one of them received proper care and lived better because of it. Not because their situation wasn't serious, it was, but because they had information. They acted on it, and they refused to accept that what their body was telling them was something to simply endure. You are not too old for this to matter. You are not too far along, and you are not imagining it. If something feels wrong, that feeling deserves to be taken seriously by you, by your family, and by your doctor. Drop a comment right now with the word "aware" if this video gave you something new. Share this with someone who keeps brushing off their symptoms, someone who bought wider shoes last year without asking why, someone who stopped taking the stairs without quite knowing when that started. This information was meant for them. Subscribe to this channel because every week I bring you medical knowledge that belongs in your hands, not locked behind a doctor's appointment you haven't scheduled yet. In the next video, I'm going to cover the 5 foods cardiologists actually eat every single day, and the 3 that most seniors are still consuming that silently damage the heart muscle over time. You will want to see that one. Until then, take care of your heart. It has been taking care of you for a very long time.